structural issues of the heart itself. Jill had several patients that kind of nailed everything down. So to start with, I want to connect back to is we were looking at EKG strips. So in your packet that you have, that's this arrhythmia recognition packet, I want you to find the one that there's two that I want you to identify, and they are probably going to be the last ones I pull up. Cynthia was showing me hers. This one that says third degree AV block. And don't anybody say blocks aren't going to be on the test. That's not what I'm doing. And this other one that is labeled idioventricular rhythm. Looks like that. Okay? It looks almost just like the third degree heart block. Okay? All right. So one of the things was, let's talk about pacemakers. So in order to start talking about pacemakers, we have to talk about the relationship between the electrical activity and hemodynamics, right? We've talked about hemodynamics this summer, and hemodynamics being basically the pressures of fluid movement through the heart, right? So you have to have a pressure in the right atrium, pressure in the right ventricle, pressure in the left atrium, pressure in the left ventricle, in order for this pump system that we have called our cardiovascular system to function. And it has to be synchronized. I mean, we have to have synchrony between the atria and ventricles so that we get volume to create, we have to have preload to create what?
Heart.
Stroke volume. You got to have preload to create stroke volume, right? And you got to have a strong muscle. So you got to have contractility to have a sufficient cardiac output, and you do have to have some resistance to have a decent blood pressure. Okay. So in order to have sufficient hemodynamics, let's say you've got plenty of blood in the system, you've not lost blood, you've got a great pump. That pump's got to have a signal. It's got to have something to say beat, right? And the lack of or insufficient beat signal creates the indication for a pacemaker. Okay? Does ventricular tachycardia indicate pacemaker?
Sometimes.
Ventricular tachycardia. Pacemaker. I didn't say pacer defibrillator. Pacemaker. Nope. I know that you know this much. What do pacemakers treat?
Brady.
Slow heart rhythms, any kind of Brady or lack of a rhythm, right? So bradycardia alone, you'll remember this from adult 1, bradycardia alone, heart rate of 38 is not necessarily bad, right? Depends on what?
The condition of the patient.
The condition of the patient, contractility and stroke volume, right? So, however, somebody can come in the ER that's in very good health with a heart rate of 30 and be unstable, right? So Cynthia and I were talking a little bit today. If we had someone who came in who got all depressed and they went in and grabbed grandpa's beta blockers, the whole bottle, just had it refilled, and this person swallowed a month's supply of beta blockers, right? What do you think the effect on the heart rate is going to be on this healthy, normally healthy 23-year-old individual?
It's going to take
What's going to tank?
the blood pressure and the heart rate.
Heart rate and blood pressure would probably tank, right? Make sense? Because you've got way more beta blocker in the system than you need. But they come in, she's got a heart rate, this person's got a heart rate of 30. They have a heartbeat, it's just unstable. So what would we do? What do you do for unstable bradycardia? Atropine, and okay, so you try atropine, and maybe it works for a minute, but it's not going. We're not going to put them on an atropine infusion because all the beta blockers are going to be there for a while, right? Right? I mean, it's going to be in the system. It's going to take a long time for all those beta blockers to get out of the
So
system.
is that when you would do a temporary?
So that would be an example of an indication for a temporary pacemaker. So I think Brooke and I were talking. No, that was you and I. So we might not necessarily. Did we talk about this at lunch too? 23-year-old not necessarily needing a pacemaker the rest of her life? Okay, I can't remember. I'm losing my memory. I can't keep Avery and Macy straight, so anyway. Yeah, I'm not gonna let you leave that down for a while.
I know.
Okay, so anyway, this 23-year-old who's normally healthy may not need a permanent pacemaker. We may not need to put an incision in her chest and a wire in her heart forever, okay? So we can put a temporary pacer in. Who saw a temporary pacer placed? Was that you and Irene? Yeah. So we get venous access, take a catheter, float it down to the right ventricle, and so if you remember the anatomy here, so right ventricle, left ventricle, we take the pacer wire, feed it down in here, and it sets at the apex of the right ventricle. And then we have a box we connect it to. You have a heart with a pacemaker?
I did last week.
Okay. All right, so the temporary pacer wires for that's a little bit different. Talk about that in just a second. But for this person that Jules and Irene saw in the ER, we have a temporary pace wire, and it looks like a central line, is what it looks like when it's placed. You put it in the femoral vein, or you put it subclavian vein, or the IJ. They do IJ? Yeah, usually they do, because in most cases it's quickest and safest, and you don't know how long it's going to be there. So I'm building up to something as far as nursing interventions and that sort of thing. So I'm just gonna. So we put the wire in, we connect it to a box, same kind of box you saw. So it's a device about so big, it's got a screen, and we can tell it to pace at a rate of 50, 60, 70, whatever we think would be sufficient. And commonly in a situation like this, when we have someone who's unstable, they'll default to about 80 beats a minute, which should be a nice productive heart rate, and see if that stabilizes blood pressure. So you can see the relationship between electricity and hemodynamics pretty immediately, right? All right, so that's a situation where you would see a rhythm that looks like complete heart block. And I know that she's not going to test you over the blocks, but what you do need to know for pacemakers is that complete heart block is an indication for a pacemaker, right? That's a reason to put a pacemaker in, right? And it may be an absolute indication for a permanent pacemaker. Right? I think I told you the story about the guy I had that they thought had seizures. Did I tell you all this story? And he had a car accident, and I'm taking care of him, he swallowed his pills. I didn't tell you all this?
No.
Okay. So several years ago, I'm taking care of this guy in ICU, and he had he had gone off the road and hit like a utility structure. Not enough to, he wasn't like all banged up. He had some bumps and bruises, but nothing bad. But the people who saw his car go off the road run out to see what's going on, and when they get there, he's, doing this kind of thing. So they think he had a seizure, right? So he comes to the ICU for monitoring for seizures. Guess how many seizures he had while he was in ICU? 0. No seizures. So I'm taking care of him, and the attending physician comes in and he says, this guy's doing fine, he's not having seizures. He's dosed up on Keppra, so we're gonna send him out of the unit. Okay. So I'm going in to give this guy his pills for breakfast. He's eating his breakfast, and I'm standing opposite the monitor.